Hey guys, welcome to another presentation. This one we're going to talk about communications. We're going to talk about a couple different types of communications. We're going to start out talking about radios and that type of communications, communication systems, and then we're going to move into interpersonal communications and how to communicate with our patients. So think about how we get called out to a scene. We have to access the system, or our patients rather have to access the system. So they have to have communication between the person who needs help and the dispatcher. This is usually done via a public telephone. It can be a public telephone, or I guess a private telephone, or it could also be from a radio from fire or police. So basically, patients access the system by calling 911. And that's just true in this country. Some countries, like over in Europe, they use 119 or 999. And sometimes in other countries, you actually have 3 different numbers if you want police, fire, or EMS. It could be 111, 112, and 113 for, police, fire, or EMS. It all depends on where you are. Fortunately, in this country, by and large, we use 911 to get access to all 3, fire, police, and EMS. So the call comes in, and who does it go to? Well, it goes to dispatch, although there's a potential that it could go through what's called a PSAP, or a public safety answering point. For example, in Austin, they use a PSAP, and what happens actually is that the police department answers first, and they have to figure out basically fire, police, or EMS, and then they send it to the appropriate personnel, to the dispatcher. So the call gets dispatched, there is an alert sent to personnel, and the personnel are sent to the scene. There are a few ways this could happen. It could be radio paging, it could be telephone, it could be a voice over the radio, it could be via cell phone, or it could be through a mobile data transmitter, or an MDT. I'll write that out for you. Mobile data transmitter, or terminal. All right, so let's talk about dispatch and the EMS unit. So you got the call, you're working on the ambulance, the dispatcher has sent you out to the call. How do you want to communicate? Well, first you should tell them that you're headed to the call so they know that you're going and they don't have to send anybody else. And then you let them know when you get there. You tell them you're on scene. You can ask them for special assistance or any additional help or resources. Let them know when you're going to this, or when you're leaving from the scene, and where you're going. So not just arrival at the receiving facility, but where, which one, which facility. And then when you're done delivering your patient to the hospital, you let them know over the radio that you're back in service and able to take another call. Dispatch can also potentially help you with assistance with a mechanical or navigational problem, although navigation should be something that you become familiar with as you work in whatever district you're in. So they're not too happy always to help with navigational issues, but they certainly can if something's not working properly. You can also get immediate assistance or information from police, fire, or the highway department. And dispatch is responsible for the general coordination of the units, figuring out who is the closest unit to that call, who should take it, where should they go, that sort of thing. Now I'm going to talk about the EMS or hospital physician. So one of our responsibilities on the ambulance is to let the hospital know that we're bringing in a patient. So we want to let them know fairly quickly after we get into the ambulance. When we talk on either the radio or the phone, we can actually ask to talk to a doctor or to online medical direction. We function under physicians, and there are medical directors, and doctors can provide us medical direction, or basically tell us what to do, over a phone or the radio. When you call and talk to the hospital, they do have the choice to send you to a more specialized healthcare facilities. Some of these facilities include trauma centers. Some of them also include cardiac care centers, or heart pain, like chest pain centers, or maybe a stroke facility, or pediatric hospital, so a children's hospital. There is also a way for one hospital to talk to another hospital via radio, although this isn't very common. It's more common for hospitals to talk to hospitals over the phone. Support agencies. So this can be anything from support from like police department or fire department to something like Red Cross if there's been some sort of disaster. So those are some examples of supporting agencies, and we can use some of our communication systems to talk to them sometimes. So we could actually go through dispatch. It may be that we don't have the right radio channels to talk to the police department, so we can go through dispatch to talk to them. Or it may be that we can use our radio systems to talk to directly between field units.